Welcome friends. We are revising homeopathic remedy Spongia tosta, and here we are reached to the part 7a, which is current clinical correlation. We have taken the text from Allen's Keynote, and this is a very good study not only for BHMS students, interns, house physicians, but professionals at large also. And this is very important for MD students. I am Dr. V.K. Chauhan. So here we are going to have the insight into the constitution of Spongia. The study of constitution in homeopathy is not merely an academic exercise, but it is a clinical compass. A patient's somatic and psychic constitution, their cravings, aversions, sensitivity to heat, cold, their dreams, fears, and functional tendency reveal their intrinsic susceptibility. They tell us what disease is likely to develop, how fast it will progress, and what are the things which may trigger or may precipitate its onset. This constitutional portrait also uncovers the underlying miasmatic tone, and this allows us to not only participate in exploring the hidden pathologies which will progress, but also allows us to anticipate the possible direction of pathology long before the symptoms appear. In this preclinical window period, homeopathy becomes preventive medicine. When we examine the Spongia constitutionally, we are looking at a patient whose internal reactivity precedes the disease. Their dryness, their constrictive sensation, their characteristic fears, their emotional restlessness, their peculiar food desire and dream patterns, these are not just random. They have early alarms. They guide us towards the primary intervention even before the pathology manifests or becomes advanced. So friends, here we go to the PQR2, and PQR2, Allen tells us, especially adapted to the diseases of children and women. So far diseases have not been developed, but these are the candidates for our clients for the future development of disease. What kind of their physical attributes we have? They have light hair, lax fiber, fair complexion, and similar constitution we may encounter in bromium. Thermally, they are chilly, and their side affinity is more on the right side. They will have the problems. So let us go ahead. We find that these somatic features, constitutional build, where this medicine will be having good action. These are the people who have been having inborn susceptibility to respond to Spongia as a medicine. So further explore, this particular drug is having some sort of tubercular base, pseudosyphilitic base. So some of the features we can anticipate. Dr. Allen has not given us the full-blown physical attributes, but then our basic perception on the basis of whatever he has given, we can understand the patient is fair, delicate skin, thin, narrow-chested individuals. They have very soft, lax fibers. They have rapid glandular changes like thyroid, lymph nodes, etc. They are hyperreactive in the initial phase of their early life, and females, they are very sensitive. So this all gives us the impression that, and it points to children and women who have tubercular constitutional features. Thermal sensitivity, patient is chilly. Why he is chilly? Because they are in core tubercular patient. The tubercular patient have poor heat retention, rapid cooling of the body, hypersensitivity to temperature. Iodium sphere, thyroid also regulates the basal metabolic heat production. Disturbances of this particular gland, maybe hypothyroidism, will predispose the patient to chilliness, especially at night. And what about side affinity? What is the important feature it carries from clinical point of view? Many iodine-based anti-tubercular remedies like iodium, bromium, spongia show right-sided glandular swellings. So let us go to the second component of constitution, that is psyche, and we are going to give some thought to temperament. And we have temperament is anxious. The Ellen has not given this particular feature, but then we have picked up from reverse Kent repertory. And here what we are going to see, why Spongia is anxious. The anxiety arises from sudden respiratory obstruction. When patient have dry, tight larynx, and there is a sensation as if the throat is going to close. There is wheezing, barking, suffocation feeling. These attacks produce a panic type of anxiety. There is second component, the cardiac awareness. The Spongia patient has violent palpitations. Heart sounds like a hammer, like water hammer pulse. If you have the water hammer pulse, hyperkinetic heart action is there, so that kind of a murmur is also there, and that creates a consciousness about cardiac function, and then patient has the anxiety around the heart region. These sensations provoke fearfulness similar to aconite and arsenic, but with a Spongia's hallmark is dryness. Again we try to explain why Spongia is anxious. Again, it may arise from the core feature of this particular Spongia because it belongs to iodium family temperament. Anxiety is a core feature of this family. Like iodium, bromium, spongia all have restlessness, they have internal agitation, they have irritability from glandular tension. So the spongia's anxiety is physiologically driven, not emotional. It is not the primary, it is the secondary, because of there are certain problems in respiratory, cardiac and miasmatic base. So friends, let us go to the second component of psyche, mind. And in mind, we have fear of death. Again, this particular symptom is being taken up from Kent repertory, or you can say reverse Kent repertory. And another symptom which is important, we have taken sadness, mental depression. Both the symptoms have second grade presentation in the repertory. So in the psyche we have got temperament which is anxious, and in the mental fear we have emotions which are sadness, depression and fear of death. So friends, why Spongia has fear of death? This is not a philosophical fear like calcaria, not anticipatory fear like gelsemium, but fear is directly connected with breathing difficulty. Spongia, as we recall, has the attacks where patient feels, I cannot breathe, larynx is closing, I will suffocate, and this induces a powerful momentary fear of death, which is often seen in croup attacks, nighttime suffocative spells, and cardiac palpitations with they have choking sensation. So friends, how patient is going to express it in your clinic? Typical expressions they may have, doctor, something will happen to me. I feel I will die during this breathing attack. My breath stops suddenly. I feel I will expire. It resembles aconite, but aconite's fear is from shock and fright, while Spongia's fear is from suffocation. Then again, let us see what is the cause of sadness. Mental low. Mentally, he is low. Why he is low? From cardiorespiratory exhaustion. Spongia patients often experience chronic cough, dryness. They have repeated suffocative episodes, and maybe they have clinical or subclinical thyroid dysfunction can also be there. These cause energy depletion and ultimately mental depression. So let us examine from the diathesis point of view or miasmatic point of view. From that background, the spongia has tubercular stain, or you can say some shade of tubercular miasm, and this miasm has anxiety as an integral part. Mood swings are there, despair is there, they are oversensitive. Spongia inherits this background, and this third part is the glandular involvement, especially thyroid gland, may be subclinical hypo or hyperthyroidism, or a simple thyroid irritability which can produce low mood, sadness, and emotional flatness. What exactly we see in cases of spongia? Let us examine the dream part of spongiatosta. We have again taken up this particular part from reverse Kent repertory, and here we are going to examine the dreams which are very important. Anxious dream, which is given 3 plus. So anxious dreams are most prominent dream theme in spongia. These dreams, they usually arise from the some suffocative fear the patient feels in real life, and they happen because dry constrictive larynx leads to a sensation of choking, and it further leads to subconscious continuous in the dream. The same theme precipitates because of some organic physical problem, and that is felt in the, and that impression go to their psychic deep subconscious unconscious mind. It trickles down, and in subconscious mind, when it becomes active during sleep time, they have this kind of dreams. They have sudden palpitations, and it gives the sense of impending danger. And miasmatically, tubercular hypersensitivity or sensitivity leads to inner restlessness, and the 6 typical experiences which a spongia patient may have: dreams of being chased, dreams of losing breath, dreams of being trapped and suddenly waking up grasping chest. This is very similar to Econite, but again, Spongia's anxiety is linked to breathing difficulty, not acute fear from Econite is because of shock. Please remember, it is not because of this kind of a insecurity which patient feels because of some organic symptoms. Friends, another dream is of fire and misfortune. So here, this represents this kind of a dream represents the panic, heat and destruction, but at a very milder grade. It is not 3 plus, it is 1 plus. And they dream of fire because fire symbolizes threat or emergency. Emergency like the suddenness, what we see in suffocative cough, heat rising in the throat and bronchi. There is uncontrolled fear at clinically points to like in children's with croup who wake up frightened, screaming or coughing after such dreams. So dreams of misfortune, friends, again it has got 1 plus intensity value system, and they are generally associated with some sort of a loss, some anticipation of fear and danger. There can be harm to self emotionally, somatically, or their near and dear ones like their extended family persons. There can be some apprehension of and fear of like accidents, something which is they are going to lose, illness, they are going to lose their health. Why it is something like this? Spongia has an underlying fear of death, and this translates into dreams where you will find things go wrong and someone dies, something terrible occurs. This aligns with the anxious tubercular diathesis. Friends, we go to the next dream which is visionary dream. It is 2 plus and there is an important keynote. Spongia dreams are often fantasy-like, especially visionary dreams. They are like fantasy, they are symbolic dreams. They are unusual scenes and prophetic or imaginative. This visionary quality comes from tubercular mental sphere, and remember tubercular remedies like phosphorus, tuberculinum, calvaria phos, spongia, they share one thing, artistic imagination and vivid dreams. They during their lifetime they have lot of dreams, vivid dreams. And then what visionary dreams may look like? So we may find seeing unusual being or forms and cities, mountains, colors, lights, feeling out of body sensations, dream that feel like messages, strange, symbolic imaginary is there. Friends, next important area in the mental sphere is desire. And here the patient of spongia desires alcohol. Alcohol is not a 3 plus symptom here, it is only 1 plus symptom. It indicates that spongia patient may show a mild to moderate craving for alcohol. However, it is not marked rubric like nux vomica or sulfur, but it presents to give us enough direction or point to be clinically noticed. Just make note of it. You don't have to intervene much. Their psychodynamic interpretation to my mind comes to as alcohol craving reflects inner tension, and this is a central theme in Spongia. Spongia patient often feels internal tightness, constriction, anxiety, especially about health, future, and there is a sense of suffocation. Now, alcohol becomes a psychological escape to loosen the inner tightness. Clinically hints Clinical hints include in early emotional phases, mild desire for alcohol appears during the stress, fear, and exhaustion. So there can be a gentle craving, usually in the evening, and nothing habitual about this alcoholism. This is often associated with tension, anxiety, anticipatory state. Second important thing which we find in desire is desire for cold drinks. Spongia tends to desire cold drinks. Again, it is a 1 plus symptom. It is a mild symptom. Again, not a dominant rubric, but consistent with the remedy's core theme. And why it is having the desire for cool drinks? We have the remedy logic is Spongia is fundamentally a dry, hot, tight, constricted remedy. And cold drinks provide a momentary soothing to the dryness like dry throat, burning chest, barking dry cough, as if saw going through wood. Mentally, the person feels burning anxiety, internal dryness, and tightness, which finds relief in cooling sensations. In the contrast, what you find, Spongia desires cold drinks but feels worse from the cold air, especially at the neck and chest. This paradox is typical of hot dryness internally, sensitivity externally. Friends, again in desire we find delicacies are there. It is 2 plus in Kent repertory or reverse Kent repertory. This is the most important of three desires, like alcohol, cold drinks, and delicacies is having greater value system for us. There is a strong liking for tasty, refined, delicate foods, sweets, bakery items, cakes, pastries, mild refined flavors, custard, puddings. These are having soft texture. This food is having very soft and chocolatey taste. This is deeply related to Spongia personality, need for softness and comfort, and this in a way points to oral personality traits. Therefore, the Spongia individual is sensitive, emotionally brittle, easily frightened and anxious. And because of this inner turmoil, they seek emotional comfort through soft, sweet, delicate food. Delicacies are symbolically going to offer ease, pleasure, emotional soothing because all these food items, when taken, they secrete in the central nervous system serotonin, and serotonin is a very calming neurotransmitter we have. And delicacies becomes a substitute for missing emotional insecurity. They feel secure with them because there are neurotransmitters which are going to give us a sense of peace and sense of serenity rather than anxiety. So there is a aversion to beer. Kent repertory gives us 1 plus and aversion to beer. Why Spongia dislikes beer? Beer is cold, fermented and often produce bloating because it contains a lot of air which is present with beer. They already have a hyperreactive dry spasmodic respiratory tract, and beer is a cold kind of a thing. Along with its fermentation, it gives reflex spasm of larynx and bronchi. Beer often increases acid dyspepsia, gastric distension, which indirectly is going to cause acidity, which is going to regurgitate into the esophagus, which will cause dry cough. GERD is a common cause of dry cough. Again, there is a aggravation from fat, which is given in 2 plus. So fatty foods demand more pancreatic activity because pancreatic juices are there to help us in digestion to fat. Spongia is a glandular remedy where pancreas may also be affected and may not produce proper enzymes which will not be able to digest this particular food item, leading to cause heaviness, fullness and indigestion. Then we have milk intolerance, or you can say milk aggravation, 1 plus in spongia. So the milk produces mucus formation. It also causes fermentation in the abdomen and going to cause distension and burping and respiratory distress. So friends, we go to now causation. Constitution is closely associated with diathesis, and here we find spongia is having tubercular diathesis. And here comes the PQR1 for the tubercular diathesis. What Ellen tells us, spongia has tubercular diathesis. So what is spongia tosta? Has to do something with tubercular diathesis remedy? No, traditionally this remedy is grouped into the fibrous, dry, glandular constitution. Spongia has many traits that align strongly with tubercular miasm. This ultimately results in tubercular diathesis predisposition. So it is prone for restless, consumptive, wasting, alternating and hyperreactive constitutional state where you will find rapid metabolism, wasting and fatigue, sudden weakness is there, alternating complaints like mental complaints will alternate with physical complaints, respiratory sensitivity is very marked, laryngeal stenosis or laryngeal compressive tendency, spasmodic tendency is there. There is a fear of suffocation, fear of death, anxiety, excitability. All these point to tubercular diathesis and tubercular miasmatic predisposition. Then second component of causation for spongia is ailments from. Here the ailments from is from tobacco. This is not given in Ellen's keynote. However, in generalities we will find 3 plus representation of tobacco aggravation. Tobacco exposure in any form, smoking, chewing, passive smoke, smell, it is going to worsen the patient's symptom or actually going to trigger them. And tobacco irritates the respiratory mucosa, produces heat, local dryness, and ultimately there is a reflex constricted airways. There is a spasm because respiratory tract, GIT tract, our urinary tract, blood vessels, cardiovascular system, they have involuntary muscles and they act under most of the time sympathetic activities. So this particular tobacco is going to initiate directly and indirectly, which will result in constricted airways. It is going to cause immediate aggravation, dry, barking, constrictive cough as an exciting cause. Tobacco smoke causes laryngeal spasm, a hyperreactive stenotic larynx, and tobacco worsens the cardiac irritability, palpitation, anxiety, sudden weakness. Nicotine stimulates the sympathetic system, which increases the pathological markers like what you will find in cardiovascular system, palpitation, racing heart, and emotionally there is a panic state, and ultimately general feature of exhaustion supervenes. So friends, we go to the next element from, and it is PQR16. Spermatic cord swollen, painful, testicle swollen, bruised, squeezed after suppressed gonorrhea or maltreated orchitis. You can see the genital tract, and from urethra you will see that upwards urethra is connected to prostate, prostate is connected to your seminal vesicle, and from seminal vesicle we have vast difference, it goes to epididymis and ultimately testis. This is the pathway which is adopted by gonorrheal infection. It is an ascending infection in the male genital system. So whenever there is a spongia case, you will find it has a deep action on the male genital organ, especially you will find swelling of spermatic cord, testicular inflammation, and which gives a sensation of bruised or crushed sensation. A history of suppressed or maltreated gonorrhea is the backdrop, or you may find that there is a history of improperly managed orchitis. Maybe after mumps, trauma, there is a wrong line of treatment. This combination makes the symptom very characteristic. These sensations are very important for prescription. Spongious pain, there is a bruised pain as if bitten. The patient holds or supports the testicle due to pain. And there is a squeezed, compressed pain as if someone is gripping the testicle cord. There can be dragging pain. The spermatic cord feels thick, heavy, stretched. This bruised and squeezed sensation is the key differentiation note from pulsatilla, which is mild drawing pains, or from rhododendron, where you will find neuralgic, weather sensitive pains. So clinically, this feature corresponds with chronic epidermolysis after untreated or improperly treated gonorrhea, post-mumps orchitis, where spermatic cord congestion is there, and chronic testicular pain following suppressed urethral discharges. So friends, thank you very much for your patient listening. However, I would like to remind that as the disease journey progresses from constitutional to the pathological phase, the value of symptoms shift. Once particular generals dominate, we enter the second phase of the disease, secondary stage of the disease progression. And by the time when the organic changes are established, we are in the tertiary stage or phase of the disease. And please remember, in the tertiary phase, whenever it appears, the characteristic generals they fade away, only pathological particulars remain. But at this moment, our present focus on Spongia Constitution lies at the very beginning of its continuum. Here is somatic trait, psychic makeup, desires, aversions, fears, dreams, functional modalities serve as a primary compass. They help us to recognize that the patient before disease takes hold. Understanding spongia at its constitutional core therefore equips us not only to treat the disease but prevent it. by the intervening during the earliest, most responsible or responsive phase of susceptibility. So friends, with this I say again thanks for your watching and patient listening to me. Please remember, sharing is caring.